Hola, hola. Soy su tía Jazmín, lista con mi cafecito para entrarle al chisme. Vamos a entrarle al chisme porque déjenme decirles. This nurse, she said, "You're fine," while this mama was clearly not fine. So we're gonna get into this story. And welcome back to Tia Jasmine Spills the Birth Tea, where we talk about birth, chisme, and all the wild things people have to deal with when having a baby. Today's story had me clutching my cafecito because, whew, déjale tomo. Because when a mama says something feels off, we listen. We listen, Linda. Okay, let's get into it. Bad nurse birth story. At 40 plus 5, I gave birth to my little one. The night of January 7th, I started having contractions, and by 8 a.m. on January 8th, they followed the 511 rule. I called my doctor and she told me to come in. After being confirmed at 4 centimeters and recorded another hour of 511, I was sent home. Basically, they were short-staffed. As a first-time mom who lived 30 minutes away from the hospital and was Group B strep positive, I was frustrated and scared. Okay, let's pause. So, if you don't know, the 511 rule means your contractions are 5 minutes apart, they're lasting 1 minute long, and this is consistent for 1 hour. This is usually something that the hospital gives you as a reference as when to call them. So it's a sign that you are possibly in labor. It doesn't mean your baby is coming right away. When someone's feeling frustrated and scared, it can feel really intense. I have supported families for the last 10 years, having babies at home, having babies in a hospital, and the biggest thing for me, helping them stay grounded and calm. So the first thing she's saying here is she felt frustrated and scared because of a staffing situation. Okay, let me not get ahead of myself. Let me keep reading. Originally, I had been told to go to the hospital early to make sure I got the 4 hours of antibiotics needed for a healthy baby. Nonetheless, I was sent home. I came back 5 hours later in excruciating pain. By the time I got to triage, I couldn't walk due to back labor. My legs were numb. After spending 40 minutes in triage where I was 6 centimeters, they finally were able to admit me. When I met my nurse, I told her I was Group B positive and needed my antibiotics. She looked me in the eyes and told me she didn't know what that meant. What? Between the screaming and the contractions, I tried to explain to my labor and delivery nurse that it meant to be what it meant to be Group B positive. Eventually, another nurse came and put in the order for my antibiotics. You, the patient, had to educate your labor and delivery nurse on what it meant to be Group B positive. So many red flags. Let's go on. Meanwhile, my main nurse is trying to get an IV in me. She can't. After 3 tries, she calls for help and another nurse gets it in. 5 minutes later, main nurse steps on it and rips it out of my arm. She does this more than once. Bro. Mija, let me tell you something. You go to a hospital to receive medical care. When you go to a hospital to receive medical care, the expectation is that your medical team is properly trained, educated, and prepared to care for you. This is clearly a nurse that should not be in this space, should not be responsible for your well-being. They don't know what they're doing. Oh my gosh. So she goes on to share, I asked for an epidural, but the anesthesiologist couldn't give me one since they couldn't keep an IV in me. 2 hours after being admitted, my husband asked where my antibiotics are. Main nurse says she doesn't know. Other nurse overhears and tells her she's supposed to get the antibiotics and put them in my IV. I finally get them an hour before birth. Once baby is born, OB tells me what the rest of the night will look like. She leaves the room and the main nurse comes back with a catheter and starts to try to insert it. Confused and in pain for my several different tears, I ask why she's trying to put a catheter in me. She tells me it's protocol. I tell her I'd rather just go pee. She insists that she wants to put it in and tries again. I scream at her to get off of me. During my 1-week postpartum visit, a different nurse goes over my chart and states that it's a good thing I got my antibiotics right away since I was in labor and delivered for 4 hours. The nurse lied on my chart. A week later, I get a bill for an epidural that I did not get. The nurse didn't note that I was unable to get an epidural since she couldn't get an IV in my arm. Where do I go from here? Okay, mija. Ay, no. Ok. Vamos a tomar cafecito porque... Me estresa. Me estresa esta situación. I am so stressed with reading this because you are going to the hospital to receive care. Your medical team is there to provide you that care professionally, ethically, sustainably, without any hitches, any major hitches on the road, right? So when that happens and somebody can't do something as foundational as putting in an IV and keeping the IV in, that can be a huge sign that you need to go to another hospital. You are not obligated to birth in this space. If they are not taking care of you, if they're not being respectful, if they are not doing their job, why are you going to stay there? That's one. Another thing is that why is this nurse still taking care of you? I know all the should haves, could haves, would haves already passed, right? But for any future mamas who find themselves in a situation where your nurse is not able to insert an IV, pulls the IV out of your arm because she stepped on it, you can request another nurse. You are not obligated to have this nurse take care of you. Clearly, she's not competent enough to care for you during such a sacred time. You're having a baby. The simple fact that she didn't know what a group B positive meant and wasn't able to provide you with the proper medication in time, if something would have been wrong with your baby at birth, who was at fault there? Why didn't your medical team provide you with the right medication needed for your health and your baby's health? Then there's also the layer of the anesthesiologist. So if you don't know, the nurse doesn't put in the epidural. It has to be a specific person that specializes in anesthesia, because an epidural numbs you from the waist down. So it has to be a specialist that gives you an epidural. Whenever you receive any medication, whether it's by choice or because you have an infection or whatever it may be, you have to also be connected to an IV for fluids, right? That's just the way the hospital works. If the anesthesiologist noticed that she didn't have an IV, why didn't they say something? It doesn't make sense. When you are being billed for the birth of your baby, you can always question the bill, ask for a detailed bill, and if you notice something on there that wasn't the case, you can, I think it's called file a claim or appeal the receipt and let them know what is on my chart is not factual. This is what happened. I have my partner as a witness and this other nurse overheard. So mira, mija, in order to support you in minimizing this experience happening to you, please remember, you can always use your voice, and you never have to deal with mistreatment and a lack of knowledge like this mama had to. Así que hay que acabarnos este cafecito porque... Thank you for sipping this birth tea with me. If you ever had a nurse ignore you during your birth, I am so sorry that you had to deal with that, but please know that you have options and there are resources available, which I'll share in the comments below. Make sure you like, subscribe, and comment because I'm getting into more birth cheesemate and tea in the next video.